Trouble speak, young God, they welcome. Not discontent, the cause commotion. This rhythm got me feeling good, and this feeling got me in the mood. So what's the make a dance? Body wale, kaloko shere. That's all one please. It's a banger.
Welcome back to this channel. As you can tell by the title of my video today, I recently had a breast cancer scare. That was 3 weeks ago, and it's still ongoing. Actually, we've not had a complete diagnosis, even though we now know what it is, but it's not stamped in the books that this is what it is. So guys, well, firstly, let me appreciate you. If you're new here, thank you so much for stopping over. I am that one and only Niger chick. I make lifestyle straight talking videos and pretty much anything that interests me, including food recipes, reviews, hauls, and crime stories. And if you're my regular subscriber, thank you so much first. And if you're my regular subscriber, thank you so much for clicking on this video. You're really appreciated. So guys, let's dive in. Recently, I have been on a health journey. I've been drinking more water. I've been eating right most of the time. I've been taking care of my skin. You know, I'm just living my best life generally. I've been taking my vitamins. I just started taking some inositol and some hormonal pills because I don't have PCOS, but I have hirsutism, so I've started taking drugs for that to make sure I reduce the number of hair growth. So I've just been generally, trying to take care of myself. Then 3 weeks ago on a Sunday, I went out with my nephews. We just went to lounge. We went to a game shop. After that, we went to get some food, we went shopping, just like that. So we had a really fun day, which I spent mostly standing up, walking around. But during that time, towards the evening time, I felt a back pain. I thought because I had stood up a lot, I was standing all day, walking all day, so probably my back, is starting to hurt. I didn't pay no mind. So when I got home, I felt a sharp pain on my chest, just in the middle of my chest. And the pain was persistent, like it's just sharp and it goes sharp. And I was like, what the hell is going on? So I took paracetamol, is a pain relief tablet, and slept and went to bed. On Monday morning, I woke up. The pain was now consistent. I knew there was something there. It was painful. So I went to have a shower and I started looking at the area and I found a lump in my breast, just by the side of my breast. A very, very hard lump. It felt like a bone. It wasn't moving and it was very, very painful to the touch. It just like as soon as I discovered it, it became extraordinarily painful, guys. So that Monday morning, I watched it because I don't really rush to the hospital when something happens. I tend to watch the situation first to see if it's something that will just, resolve on its own. But it didn't resolve on its own. So I was watching it that Monday. On Tuesday, I was like, On Tuesday, the lumps, they're getting bigger. So I had to call the doctor. Now, I called the doctor of a very well-known big clinic. Like, when I mean big, they have like lots of specialist doctors. They were quite expensive because in Nigeria, most good healthcare are very, very expensive. So I was like, this is my breast. I'm not going to go to any hospital just for any doctor to look at it. I have to go to the best hospital. I went to the doctor. I paid for consultation fee. I went to see him. This doctor was a man in his late 60s or early 60s, an older man. But the way he was dressed, I wasn't impressed. He was dressed like a street tout. I was like, well, this is, he must know his stuff. I don't really judge people by their outer, look. So I relaxed because he was older for some reason. But then things started falling apart quickly. He asked me to remove my top, which I did. Then he just, he asked me to remove my top, my bra. I did all that. And what he did was, without gloves, he just came, poke, poke, poked at a lump on my breast. And what he said immediately was a shock. I was like, I'm going to excise it. He said, I'm going to excise it, I'm going to remove it. When I'm done removing it, I'm going to take it to the histopathologist to determine what it was. And I was like, there was no history of me if I've had an aunt with breast cancer or if I've had a family member with breast cancer. No checking of, my blood pressure, nothing. Just go and pay, let's excise it. So I was like, okay, how much am I to pay? He said, he said, go to the reception. I'm going to call the nurses. They'll tell you what to do. So I stayed at the reception with my mom because my mom went with me. I stayed at the reception and the nurses called me and they asked me that I should see the female gynecologist because apparently there were two gynecologists in that hospital. So I went in, I sat down and she was like, first of all, you have to pay 70,000 naira first for general anesthesia. I was like, but you guys don't really know what it is. What are you excising precisely? She was like, I don't know. I don't know. That's what she was. I don't know. I wasn't the one that examined you. She was so rude. It was like she was talking so it was for me. I didn't feel like a human being at all. I felt like a walking bag of money. I felt that's how they saw me, like a walking bag of money without. Maybe I didn't seem human to them. That was my experience, guys. I didn't seem human to them. I was something that could probe and poke and, there was no humanity in it. She was like, yeah, go pay for 70k general anesthesia first. Then we've not talked about the surgery yet. That the surgery just deposit 100,000 naira. After the surgery, we'll do check and balance, and we'll see how much our pills and your stay and everything costs. Go deposit 100,000 naira. I was like, is that it? She was like, yeah, go. I was the one saying, there was no CT scan, no mammogram, no MRI, nothing to see what is actually there. Even if you're going to do surgery, at least you're going to see the length, the shape of what you're going to do. Because personally, I didn't think he examined me well. He just poked on it. And she was like, just go, pay. We are professionals here. We know what we're doing, I actually went and I paid. And they booked me for surgery the next day. That was on Thursday morning. So I left the hospital. I was going home. I was like, I was very, very uncomfortable. The pain, my head, I was not at rest. So I then remembered on my ride home, I remembered that I did my IT somewhere in a hospital, and the doctor, I saw the way he related with his patients. He was quite, it was good. He's a good doctor. So when I got to the hospital, everywhere had changed. My God, the whole place was looking huge. It's shown that he has grown over the years. So I asked to see him, and the people there, the receptionist said he was not on seat. So I was like, who is around? They said, there are doctors around. You can go see any of them. So I paid for a consultation fee. I went there. Immediately I got into the office, she told me that, she actually asked me a bunch of questions. Let me see what it is. I laid down. Remember at the other clinic, there was no lying down. I was on the chair where I was sitting. He didn't ask me to lie down. He just asked me to he just poked. He didn't ask me to lie down or anything. So she asked me to lie down. I laid down. Then she used the gloves, poked around. She was like, okay, this is not moving. Okay, what we are going to do first is to get you a CT scan to see what it is, if there is fluid in it, all the medical stuff. And she asked me so many questions. She asked me if I was hypertensive, if I was diabetic. She asked me if I had a history of breast cancer in my family. Yes, I do have a history of breast cancer in my family. Actually, I had an aunt who died in her late 50s, early 60s of breast cancer. So she took all that. went to the CT scan. I'll put the result up here. I did a CT scan, and it showed that there was a hard lump on my breast that was extending towards my chest area. The lump, there was no calcification, there was no fluid in it. They checked my armpits. There was no sign of lymphoma or lymph nodes. They checked the general shape of my breast. There was no changes. I didn't have inverted nipples, so it was very confusing. She didn't know what it was actually. So she said, okay, she's going to take me to the MD. That's the doctor I wanted to see. And yeah, after waiting for like 4 or 5 hours, I went home, came back. The doctor was ready to see me. Oh my God, he immediately recognized me. He was like, oh, Marilyn, how are you? Long time. We exchanged pleasantries. And that was when he now said, okay, take off your clothes, lie down, let me properly see this thing. So he saw it, he probed, he checked my blood pressure, he checked my temperature there. Just the professionalism was top notch. And he was like, okay, what I'm going to do, I've seen your CT scan. What I'm going to do for you is I'm going to place you on antibiotics and some painkillers and anti-inflammatory drugs for 1 week. We'll watch it for 1 week. And if there is no improvement in the lump, then you have to go for an MRI. He told me he would have asked me to go for mammography, but I'm too young to go for mammography because in Nigeria you go for mammography from the age of 40 to 45. I'm just 33, guys. So he was like, okay. So yeah, he was like, I'm going to put you on antibiotics. Go for a general test for me. So I went to do a blood test, a urinalysis, fasting blood sugar to see if I was diabetic. All came out good, except for my white blood cells, which were very high, which indicated that there was an infection. So I started taking these antibiotics. I took these antibiotics. Day 1, day 3, the antibiotics was done intravenously. So I was always going to the hospital and I was receiving medical checkups all the time. When I mean medical checkups, they were always like, let's see the face of the lump. How are you feeling with your antibiotics? Just, general doctor stuff. So at day 3 of taking antibiotics, I discovered that there was a small mouth on that lump, because the lump now grew much more bigger, extended to my chest area, down my breast area. So at the downside of my breast area, there was a small mouth that was yellowish, filled with pus. So I showed it to the doctor, and the doctor was like, just let it, don't touch it, don't probe it, just let it drain on its own. So before I even got home from the hospital, it started draining. My mom is very skilled at, because right from when I was a child, I had the tendency of having huge boils. So what she does because she doesn't want to scar me, I scar easily. I get keloid easily. If I have a scarring on my skin, it doesn't just disappear. I must get a scar, an everlasting scar. I have some of that. Some accidents I've gotten on my leg, my back. The scars are still there from 10-15 years ago. So my mom actually knew my skin, and what she does each time I have those kind of boils is that she takes a needle and just poke a hole and extracts whatever fluid is there in that syringe. That way she extracts the fluid and I don't get scarring. So when she saw that, she was like, man, I think this is a boil. I was like, nah, you're not so sure. The swelling, some of it was still hard. But she did what she had to do anyway. So she used a syringe and started extracting the fluid. My God. The pus that came out of this thing, we had, I don't know how many mils syringe it is. The normal syringe, I think is it 20 mils or so of syringe. The first day this was extracted, the syringe was filled with pus 4.5 times. It was a lot, and the smell was horrible. Oh my God. So she extracted it. After she extracted it that day, I felt so much relieved that I slept off, because it felt like as if something has been taken away from me, like a huge load has been carried away from me. She did that. Then she did a hot compress on the lump. Yeah, morning and night she was doing that, and the lump started dissolving. The lump on my chest is no more. Yeah, the lump on my chest is no more, but I can still feel some lump. We're still doing that. After 1 week, I'm done with my antibiotic treatment. The doctor is saying that I should watch it again for another 1 week, and if the lump is still hard, then we can go for MRI. So this is a Monday. What day is this? This is Saturday. I finished my antibiotic treatment on a Wednesday. So yeah, Saturday. So on Wednesday, I will still go back to the hospital to check if the lump is still there. The lump is still there, but it's not as huge as it was. It's still hard. It's still draining. My mom is still applying hot compress, and she's also still extracting the fluid with syringes. The mouth is healing nicely. So guys, hopefully this is a boil. Hopefully I do not have to go for an MRI to see if there is something sinister happening there. But all in all, what I want to talk about is the healthcare system in Nigeria. It's very bad. If someone like me can go through that in the hands of doctors, of a doctor, talk more of other people who are very, very ignorant and who are not so in tune with the medical system. They would have, something bad would have happened if they just went ahead and cut off a boil. How can you cut off a boil? You know, that has not even formed yet. There was no fluid in it. You just want to take it out. I felt maybe he was having sympathy for me, so he wanted to take away. But then you didn't know what it was. What if you take it out and something bad happens? You know, surgery for me should be the last thing. If there are other ways to solve a problem, I prefer to try other ways than go under the knife or go under general anesthesia. And the doctor who asked me to go under anesthesia, she didn't care. She was all after the money, because our general anesthesia is expensive, more expensive than local anesthesia. You give it on that spot. The money that I'm supposed to pay in the hospital will not be as much as 100,000. So she was only looking at the money. She was just money conscious, without a care for the patient. And I understand that a lot of Nigerian doctors are like that. There is no winning with Nigerian doctors. If you look poor, they'll treat you like trash. Like if you go to UPTH, for instance, if you go on their site, you will see some reviews there about doctors treating patients like trash because they think they are poor and cannot afford health care. Now, if you look like someone who is able to afford health care, it's a time for extortion. They will look for so many things. I feel Nigerian hospitals are more or less death traps than actual problem-solving centers, because the pattern I found is that they will want you to feel like something bad is going on. They exaggerate the situation, so you become much more scared, and that way they'll be able to extract money from you, because if the situation is exaggerated, you're able to go for more things they ask you to go for, more ridiculous things that doesn't even make sense. So yeah, now there are two doctors actually examining this case. One of them is a female one I met before the MD. She's also saying, oh, she didn't know that I worked in the lab. She didn't know, so she was saying that my white blood cells being high is a something sinister, that I still have to go for MRI, only for me to discover that she had commission for the place that I was supposed to go for MRI. So she didn't really care that it was me. She only cared about the commission she was going to have for our MRI. So I am just grateful that I am no longer in pain. Yes, I still have a little bit of the swelling there. Yes, it's still draining till now. And I am very hopeful that this is not a serious medical condition. It's not a cancer or it's not a tumor or anything. If not, it's not because, okay, if it happens, man. I'm ready to undergo what it is. But the thing is that, how am I going to be handled by the Nigerian medical system? That scares me way, way much more than, having treatment for my ailment. It's the treatment from humans, from the medical practitioners. That's the one that I'm afraid of, because I've heard of so many stories of how patients have died from things that are very, very avoidable. So guys, that's why I've not been posting for some time now, is because I have been going through really health. I've been going through a bad health scare. Yeah, by next week Wednesday I might give an update, or I might not. If you want an update for this, you can email me and send me a message. I'll give you an update. But I do have videos coming soon right now, so I'll be much more stable. I'll be much more steady here on YouTube than I have been for the past 3 months, guys. So thank you so much for stopping over. Please look at my other videos. If anyone interests you, please give it a thumbs up, click on the like button, subscribe, and I'll be waiting for your comments down below, because anything you tell me, I reply as soon as possible. Alright guys, thank you so much for watching once again. I'll see you in my next video. Bye.